Then now I'm going to put a disposable glass. Then put a goggles. I already assembled the equipments that are needed, such as the gloves, salt, toilet tissue, ice cube, pen light, tickling watch, cotton applicator, cotton balls, salt solution, tongue depressor, and lastly, the newspaper or other printed materials. So, good morning, ma'am. I'm Jessica Rosales, your student nurse for today. So, may I know your name, ma'am?
Carla po.
Okay, Ma'am Carla, the procedure I'm going to do is to examine your cranial nerve, which helps to identify for any abnormalities that can affect any factor and daily activities. Is that okay with you, ma'am?
Yes.
So now I'm going to assess the olfactory nerve of the patient responsible for the smell. So now I'm going to check the nasal passage if it is clear. Okay. So, ask the patient to close her eyes. Can you close your eyes, ma'am? Then I'm going to put my finger to one nostril. Can you smell this, ma'am?
Yes po, alcohol.
Okay. Another one. Can you smell one?
Alcohol po.
Okay. So now I'm going to assess the visual acuity of the patient using a Snellen chart 6 feet away from the patient. So ma'am, can you cover your one eye? Okay, and read this.
E, F, P, T, O, Z, L, P, E, D, F, C, Z, P, D, E, F, O, D, P, C, T, O, E, C, T, L, P, D, F.
Okay, the other one, ma'am, cover your one eye.
P, E, Z, O, L, C, F, T, D. L, E, F, O, D, P, C, T. D, Z, P, O, L, E, F. P, E, C, F, D. D, E, P, L, T, O, Z, P, F, E.
Okay. So now I'm going to assess the visual field of the patient. So ma'am, can you cover your one eye? Then directly stare to my one eye. So can you see this, ma'am?
Yes po.
This one?
Yes po.
And this one?
Yes po.
This one.
Yes po.
And the other one, ma'am? Cover your one eye. Can you see this one, ma'am?
Yes po.
This one?
Yes po.
This one?
Yes po.
This one?
Yes po.
So now, I'm going to assess the light reflex of the patient. So ma'am, can you look forward? So now, I'm going to assess the oculomotor of the patient, examine for the third, fourth, and sixth nerve. So first, I'm going to look for the ptosis is squint. So ma'am, can you look forward? Okay, so now I'm going to assess the pupillary reaction of the patient. So now I'm going to assess the accommodation. So ma'am, can you look this object? Again. Okay. So now I'm going to test the H shape. So ma'am, can you look right upward without moving your neck? Look to the left. Horizontal to the right. Horizontal to the left. Downward to the right. And downward to the left. So now I'm going to examine the X one po?
Yes po. Yes po.
Okay. So now I'm going to assess the trigeminal nerve of the patient. So first, look for the sensory for the ipsilateral face by touching, pressure, temperature, pain, and vibration. So now I'm going to assess the anterior 2 to 3rd tongue sensation of the patient. Can you identify the face po, ma'am?
Asin. Asin po. So.
Okay. So now I'm going to look for the motor for the muscle of mastification. Okay. So ma'am, can you grate your teeth? Okay. So now, note for any wasting of muscle of mastification or masseters and estimate bulk. So now I'm going to, can you open your mouth, ma'am? Okay. Okay. So now I'm going to assess the corneal reflex of the patient using a cotton. Can you look upward po, ma'am? Okay. The other one. Okay. So I'm now I'm going to assess the jaw reflex of the patient. So can you open your mouth again, ma'am? Then percuss with a hammer to the mid lane. Okay. So note for any reflex. So now I'm going to assess the facial nerve of the patient. So first I'm going to check the sensory. The taste sensation of the anterior 2 to 3rd of the tongue. So ma'am, can you taste it first?
Calamansi.
Okay, asim. So now I'm going to check the motor of the patient. So ma'am, I'm going to note for any symmetry or flattening of the nasolabial folds. So now, can you wrinkle your forehead, ma'am, or look up? Okay. So now, can you bare your teeth? Okay. Can you screw your eyes closed? Can you close? And I'm going to open it. Okay. So can you blow your cheek, ma'am? Okay. So now I'm going to assess the corneal reflex of the patient. Okay. So now I'm going to assess the globular top. Okay. So now I'm going to assess the vestibulocochlear of the patient. So ma'am, I'm going to whisper, then repeat what I say.
Carla.
Okay.
Carla.
Okay now. So I will do the Weber's and rinse test. So now I'm going to assess the glossopharyngeal nerve and vagus nerve. So ma'am, can you swallow this water? So, observe for any absence of swallowing, cough, or delayed cough, or change in quality voice. So, can you say your name now?
Carla.
Okay. So, I'm going to use. So, ma'am, can you say ah? Okay. And look of the say ah again, ma'am, and look for the movement of the palate and uvula. So now, can you puff your cheek, ma'am, and use your lips tightly, and then I'm going to, okay, if there is a air escaping to the nose, okay. So now I'm going to assess the accessory nerve of the patient. So ma'am, observe for any shoulder or neck muscle wasting or hypertrophy. So now I'm going to shrug shoulders against resistance. Okay, again ma'am. Okay. So now I'm going to turn head against resistance. Okay. Okay. So now I'm going to assess the hypoglossal nerve of the patient. So observe for wasting, fasciculation, or involuntary movement. So now I'm going to protrude the tongue using the tongue depressor and look for any deviation or involuntary movement. Okay. So now, can you move your tongue side to side, ma'am? Okay. So now, I'm going to test power by, can you press your tongue, ma'am, against your cheek while you apply pressure from the outside? Okay. So, ma'am, can you say your name?
Carla.
Can you swallow, ma'am? Okay. So, document the findings and remove the gloves and do hand washing.